Hi guys, my name's Sanjay Gupta. I'm a consultant cardiologist in York Hospital, and this is more than just medicine. So today I wanted to talk to you about this chest pain, and essentially what I wanted to tell you about is the fact that a lot of people get chest pain immediately. They worry about whether the pain could be coming from the heart, and that can cause a considerable degree of anxiety. And so I'm going to try and talk you through um, some of the things that can help you try and work out whether your chest pains are related to your heart, and if they are, then what to do about it, and how quickly to do something about it. Okay, so today what I wanted to talk to you about is the first thing to say is this: that whenever you're dealing with a symptom, particularly in cardiology, it's the nature of the symptom is obviously important, but the person who is experiencing the symptom is even more important. That means that if I had the same kind of discomfort, if two people came to me and they had the same kind of discomfort, but one was an 18-year-old and one was an 80-year-old, a completely fit, healthy 18-year-old comes to me and says, "Oh, I'm getting a bit of chest discomfort." That doesn't worry me as much as an 80-year-old with diabetes and high blood pressure coming and saying, "I'm getting this discomfort." So the, I understand. What I want to try and make you understand is that it is the person and the substrate of the person experiencing the symptoms that is the most important thing. Okay, and most symptoms in cardiology tend to become more worrisome if the patient is older or if he has risk factors. And the risk factors include diabetes, high blood pressure, a history of smoking, a family history of heart disease, very high cholesterol, obesity, or excessive stress, and of course age. So those are the things that would first, that those are the risk factors are the things that I take into account first and foremost. Okay, and after that I take into account what the nature of the symptoms are. So um, so if you're a young person, you're completely fit and well, you have no symptoms, then I'm not saying don't get it checked out. I think it is important to get any kind of symptom that worries you checked out, but I think it's less likely to be anything to be too worried about. So let me talk you through what chest discomfort, which comes from the heart, feels like. Okay, the first thing to say is it's a discomfort. It's not necessarily a pain, although it can be a pain. But it is wrong to assume that all heart discomfort is pain. Okay, a lot of people come to me and say, "Oh, it wasn't a pain. It was like a tightness or a gripping or a heaviness." Often people talk about a sensation of someone sitting on their chest, an elephant sitting on their chest. Okay, that's when people complain of that kind of symptom, that worries me. When people say, "Look, I get a sharp pain. It's localized. It's over here, or it's over here, or it flits from one place to another," that doesn't worry me at all. That is very unlikely to be the heart. One of the other features of heart pains or discomfort that is coming from the heart is that it often gets worse on exercise. And for a large number of people who come to me, the first time they start noticing it is when they're exercising. And then it gets worse and worse, and it can happen at rest. It can, of course, happen at rest without any warning, i.e., you may not necessarily be getting it on exercise, and suddenly one day you have it at rest. But if it is coming from the heart and it is happening at rest, then that really signifies that a part of the heart muscle is really devoid of blood and suffocating, and therefore you would feel very unwell with it. Generally, if a person is otherwise completely well, he feels a little niggle here, he feels a little niggle there, but he's able to do everything and he's able to laugh, etc., then it's unlikely that it's the heart. Heart pains are like raw and discomfort, it's a discomfort, it's very uncomfortable, people can't get settled, and they know something is wrong. And they can feel very clammy and dizzy and breathless. Those are the kind of symptoms that would worry me. Okay, so one other thing to say is, say in the middle of the night, if you're lying there and you get the discomfort, it feels like an indigestion and you're worried and you don't know what it is, the best thing to do is to come into a hospital and get checked out. And a lot of people say to me, look, I don't want to worry anyone. I'd rather wait till tomorrow morning. People are put off by the idea that they may have to call an ambulance or they may have to go into casualty and wait. Truthfully, all this, people who are getting chest discomfort tend to be prioritized. So if you go into a hospital, you will be taken in straight away to have an ECG done. And once you've had an ECG done, and if it's okay, that'll put your mind at rest. Of course, they do then say, look, we need to do a blood test, and that's okay, but at least then you are doing everything that needs to be done, and it'll put your mind at rest. So what I really want to try and get out of this is, if you are someone who has risk factors, if you are above the age of 40, if you're a heavy smoker, if you're diabetic, if you have high blood pressure, if you're very overweight, if you have a combination of those things, if you have a family history of premature heart disease, i.e. at a young age, or if you have very high cholesterol levels, and you get chest discomfort in the middle of the night, please don't wait until the next morning. The safest thing is to call an ambulance or go into hospital and have an ECG done. Now, the ECG may be completely normal, and sometimes the doctors will say, look, we should do a blood test, but it's always worth getting checked out. So I hope this is helpful. If you enjoyed this video, please consider subscribing to the channel, consider sharing it, and thank you very much for listening. All the best.